Here in Lugano, we presented the long-term follow-up data of the international intergroup H10 study that was promoted by EORTC, LYSA, and FIL. And we released the information coming from a median follow-up of almost 10 years from the enrollment of the patients. And we found that patients that had PET negativity after 2 courses of ABVD at the beginning of their treatment had an excellent outcome, mostly if they were treated with the combination regimen, that means ABVD plus radiotherapy, involved nodal side radiotherapy with no more than 30-36 gray for patients. And this combination is better than chemotherapy alone in terms of progression-free survival. And we found these results in the group of patients with early favorable Hodgkin lymphoma. In the group of patients with early unfavorable Hodgkin lymphoma, the experimental arm was of 6 courses of chemotherapy alone, and we did not show any different compared with the standard treatment that was 4 courses of ABVD plus involved nodal radiotherapy. So the take-home message for PET negative patients is that the combined treatment is better for early favorable, is equivalent for the early unfavorable to the no radiotherapy arms. And most important, we also updated the results on the patients that resulted PET positive after 2 courses of therapy. Here, the comparison was between the standard arm, that means continue with the initial planned therapy, or escalate treatment moving from ABVD to BEACOPP escalated for 2 courses. And we found with this longer follow-up that is no more evident benefit in terms of progression-free survival that we demonstrated when we performed the analysis after 5 years of follow-up. However, what we also found that treating patients with chemo plus radio, or treating patients with ABVD plus BEACOPP escalated was not associated with an increased risk of late side effects, namely no excess of risk of second malignancies. So the conclusion is for patients with early stage Hodgkin lymphoma, the standard regimen should be ABVD plus involved nodal radiotherapy. But in case of PET positivity after 2 courses, you can switch patients to a more intense chemotherapy regimen like the escalated BEACOPP without adding late toxicity.